Postoperative care is a very important aspect in rhinoplasty because all the tissues will be in healing. Everything you can do to enhance this process is a win for you. Number 1 is ice. During the day and the evening of the surgery, cold and moist compresses can be used over and around the eyes to minimize swelling and bruising. Number 2, incisions. If an external incision is present, care must be taken to carefully clean the incision with peroxide hydrogen and cover it with antibiotic ointment until further instructions. Number 3, sleeping. During the first week, it's better to sleep with your head elevated by at least 2 or 3 pillows to form a 30-degree elevation. This has shown to decrease the amount of swelling and to aid in the resolution of any swelling that occurs. Number 4 is activity. Care must be taken not to bump or hit your nose. Though the bones are firmly healing in place during the second week, even a slight trauma could cause some movement of the bones. So avoiding risky activities such as contact sports are recommended for at least 3 months. Number 5, wearing glasses. You should not wear glasses for at least 1 month after surgery. And if glasses must be worn, taping the central bridge of the glasses onto the forehead will allow to add as little as pressure possible on the nasal bridge. Number 6, sun exposure. It is wise not to sunbathe for the first 6 months after surgery. A sunburn can cause, That is why it's always best to apply a waterproof factor 50 sunblock whenever you're going out into the sunlight. Thank you for watching.